effect on Wednesday until the 30th of the month, emphasizing social distancing, masking, looking at the community events as far as the capacity for indoor and outdoor, reminding businesses for social distancing inside. We have, from a clinic perspective, we will start doing the rapid testing probably the middle of this week once we get the okay that our interfaces are working. The benefit to that is we'll be able to get results in 15 minutes. So we'll be able to provide that service. The turnaround time for Test Nebraska is dramatically reduced. We're getting results back now as little as 24 hours. Average is about 48. But again, we're seeing a very large detection. Not necessarily bad news. We are identifying more people and keeping them out from going out unmasked and spreading. So I think that's going to help reduce community spread. Also, a big emphasis on flu shots and tying that in as well. Is there any other questions or anything I can add? I probably got some information because they've been impacted as well.
I can give you some numbers too. Statewide, we're at 83,969 positives. We've now tested a little over 1 million people. Our bed availability, we have 31% of our acute general beds available throughout the state. 31% of our ICU beds are available, and 71% of our ventilators are available. Active hospitalizations across the state, right now we have hit our peak at 794 active hospitalizations throughout the state. Just to give you some perspective on that, on October 1st, we only had 237. So we've had a huge spike in active hospitalizations. Here locally, we've had 570 new positives over the last 2 weeks. We currently have 18 COVID patients in our hospitals in our district. 17 of those are here in Columbus. Our deaths are at 20, 12 of those in Platte, 7 in Colfax, and 1 in Nance. So we've seen a little bit of uptick there. We were at 14 for a long time. Test Nebraska, we're testing on Monday, Wednesday, and Friday about 150 people a day, so about 450 a week. We're just getting ready to expand to Saturday as well. So we'll continue testing. Staff here are in pretty good shape, and we've got surge plans in place. We're working closely with the state in terms of transfers. So we have the transfer center, which is located in Lincoln through CHI, and then we're also working with our Roamers Coalition, Hospital Coalition in our region, and so we're trying to transfer people to the appropriate place. A lot of patients that aren't COVID patients, we're trying to transfer to critical access hospitals. And so we're kind of shuffling people around to make capacity for COVID beds. PPE, we're in pretty good shape. We've got a really good supply of PPE, especially the N95 masks. So I'm feeling pretty good about that. We're now looking forward to the vaccination plan. So we're getting that organized and anticipating that we'll receive some initial vaccinations probably by the end of the year. And those will be focused on healthcare workers and first responders. Any questions for me?
I would kick off with one. When you say active hospitalizations, can you give us a description of what that means?
That's a COVID positive patient that we're managing. And we also have what's called PUIs, persons under investigation. Those are people that we suspect may have COVID, but we're not sure, but we have to treat them like they're positive. So that takes the same amount of intensity and PPE required to do that. So here in Columbus, I think we've had about 125 COVID positive patients so far since it started back in February, March. So that's not including, our regular patients. The 794 is just strictly COVID positive patients. And so we're managing those people on high flow oxygen. We're using remdesivir and convalescent plasma. We're using some steroids, and we're doing some proning, tuning them and things like that. We've been very successful here in Nebraska with that approach and have been able to keep people off ventilators. As you recall, back in the beginning in New York, a lot of people died that were on ventilators. So we've really tried to keep people off ventilators. And as you can tell, with having 71% of our ventilators available, we don't have a whole lot of people on ventilators across the state. So I think that's a good thing. I think we've also done a very good job protecting our nursing homes and our healthcare workers. And so, that really has been a big part of our success. And then if you look at the mortality rate, Nebraska, I think, is third in the nation in terms of the lowest mortality rate. Last I checked, we were at 0.96, less than 1% mortality rate. So that's something that we need to keep doing.
You'll find I always have questions, and so I hope others will either write them into the chat. I'll try to monitor that, or if they want to unmute, just so long as we avoid, kind of that overlapping of the voices and such. On the recovery rate, are you seeing some real strong, and maybe you mentioned this and I was busy watching the screen.
Yeah, a lot of people have recovered. So obviously, the people that are at high risk are people that are over age 65 and people that have underlying health conditions. So if you're not in those two categories, the chances are you're either going to be asymptomatic, not have any symptoms at all, or you're going to have very mild symptoms and you're going to get through this okay. So that's kind of what we're seeing. And so the biggest issue for us, and I'm sure for the schools as well, is staffing. Just being able to keep staffing and protect our staffing. And I know we've had some conversations with the schools in East Central about, where is the best place for our kids right now. I really believe the best place for them is at school. I think they've got the structure there, they've got the support there, and they're more compliant wearing their masks. So anything we can do to keep our hospitals open, our schools open, I think is something that we should strive to do.
And that's perfect segue for why we're even here. So we kind of jumped right into it as more and more people were admitted to the meeting. I think we're up to 108 individuals on the call right now, which is wonderful. Thank you very much for joining us. My name is Jean Schieffer. If you don't know me, I'm the president of the Columbus Area Chamber of Commerce and happy to host this. And Mike Hansen spoke very well of why we're even here. The East Central Health District, the hospital, and the schools have been having ongoing discussions, obviously since before school started, about how to manage the virus, and certainly in our community, but also in the community of our school system. So speaking with them, and they will probably have more communications to parents coming out this week. There was an opportunity for us to visit with the business community, because that's where an area where we have a lot of people with shopping, and with the holidays coming up, where there's a partnership that we can support what the schools are doing to manage the levels if possible as they continue to go up. So I was selfish. I kind of took advantage of the opportunity to ask some questions, but for those who had seen the notice, Dr. Klein from East Central Health District is going to join us when there she is. She's available as well. We did have Patrick Peer and Mike Hansen give an overview, and I'll ask you, Dr. Klein, in just a little bit if there's anything you wanted to add. I know you might have missed some of their discussion. And then we'd like to transition into what the schools have been doing, why the levels are low, what are some of the practices, as well as plant of seeds should something happen major. What does that do for employers when students might have to go home or be at home? How would the businesses need to react? And then we have Phil Raimondo on the call. You can wave Phil. He's with Balin Manufacturing. They've done a great job over the last 8 months to try to follow the curve and what's been happening with their businesses or with their employees. And so I'd like to have him speak, and then we'll open it up for questions of all of our panelists. So with that, Dr. Klein, I don't want to shirk the opportunity for you to share anything more. We did get a great overview from Mike Hansen of the hospital and the levels. Patrick Peer also spoke about East Central Health District's four counties. Is there anything you would like to add at this time? I think you're on mute.
Yes, can you hear me now?
Yes.
Okay, so I think personally, as our, our counties here, we're doing a lot better actually than what I can see in Omaha even. Um, and I think if we just continue to ask everyone to wear a mask and wash their hands, and I think keeping the kids in school, it's a great thing as long as they all stay safe. And um, I think everybody here that I can see on the Zoom meeting, is doing a great job.
Okay. Well, good. Reaffirming what we had heard, and yes, there are practical steps we can take just from an ongoing safety standpoint with our masks and our cleanliness and such. I'm sure that's what's being done in the schools. So does anybody, why don't we go to the schools and then we'll open it up for general discussion. So Dr. Lothelhus, would you like to kick it off for us?
Yeah, sure. So, and again, well, I'm kind of stumbling here for a second, but just want to start off by thanking Dr. Plaus and Jeff Onuka, who are on the call here too, because when this thing started back in March and April, we've been working real close together on how do we open our schools safely for our students and for our staff. And I can't tell you how many Zoom meetings we've been on or how many conversations we've had on the side with text messages or emails, et cetera, to make sure that we have a great and safe learning environment for all of our kids. Just kind of start things off. We started the school year under DHM 3, and so we had some precautions in place based upon that with capacities, social distancing, and some other things. And I would say that, from our standpoint at CPS, we kind of took those and expanded them a little bit and probably a little bit more cautious than what the DHM 3 had put out there. It's hard to social distance in a school when you have a high school with 1,300 students, but we're doing the best we can. We mandated masks from the very beginning. We are sanitizing when kids enter a room and leave a room and go into different places within our buildings. That has helped. We've closed down some areas, limited some capacities at a lot of our events. But when the DHM switched to 4, we stayed in 3. We didn't move to that 4 with 100% capacity at CPS. We maintained what we were doing because it was working. Our kids have been very vigilant in the process. We got a lot of questions from parents. How do you expect a preschooler or a kindergartner to wear a mask all day, every day? I tell you what, they've done a great job. In fact, I think they're doing better than a lot of adults through this process. You walk into the classroom and see those little ones, and it's just like part of their normal day now, and the expectations there. So they're doing a fantastic job. Here as of late, though, and I talked to Gene, and I know Dr. Plaus and Jeff Onuka, we have seen a surge, not with our students so much, but it's our staff with the positive cases. And so we're struggling to cover some classes. I know from CPS's standpoint, we have a lot of teachers subbing for teachers during their planned period. Because substitutes typically are in that older age bracket, and I can understand why they may not want to come into those areas where there's a lot of people. So we completely understand that. But we are in yellow. We're in school every day, all day, and we're going to continue to do that. We've told our community up through Thanksgiving. We're going to stay in that. We are going to take the Monday and Tuesday off before Thanksgiving, so our teachers can have some time to do some planning and just kind of take a break. We've expected a lot of our teaching staff since school started. They've done a tremendous job working with our kids and working with our community. Just can't say enough positive things. But with that in mind, we're a little wary of what the future holds for us after Thanksgiving. And so as we continue to see a rise in positivity, it does put us at risk to do some things we don't want to do. And I think part of the impetus of this Zoom meeting is, what will businesses do if we go to every other day classes, or if we go to remote learning? How does that affect the businesses in our community, because our kids will be home? And what we're trying to do is stop that from happening. and really plead to our community to take those universal precautions and wear the masks in public places and in the grocery store and everywhere else. So it's kind of like our little public service announcement to make sure that our community is doing what they need to do to keep our students in school. And we're going to do a Facebook Live event on November 12th. I think it starts at 6:30 or 7. More will come out on that from CPS from Columbus Public Schools. And we're going to talk about our orange and red schedules and what that means for our kids and our families. And you know, I think this is a great opportunity on the Chamber Zoom to hear from the business side of it. You know, how does that look for you if our kids are at home again like they were last fall, or I'm sorry, last spring? Because it'll be different. There's accountability, there's attendance, there's testing, there's all kinds of stuff that are going to be in place for our kids. It's not going to look the same. There's going to have to be, again, some accountability from our students through the learning, and accountability for our parents with that learning as well. So I'll stop there and I'll let Dr. Plaus and Mr. Onuga carry on.
Thanks, Troy. Just a few things to add, or I guess build upon what Troy was saying. Appreciate all that he said and agree with almost all of it. You know, here at Lakeview, we've said from the beginning that we value in-person education, and we're going to do everything we can to keep kids in person, and that hasn't changed, but it's getting closer and closer to that becoming just harder, and it's staffing. We've got staff that are starting to go out. It's getting harder to cover classes. We began the year with a 48%. Compared to previous year, we had 48% subcapacity. And since that time, that capacity has decreased. And so we're at a point where staff are not being allowed to take personal days or do professional development. It's pretty much all for quarantines or isolations, which, you know, hopefully we can get a handle on and get a little bit of a decrease in those, so we can get back to ensuring that all our classes are covered. One of the main things in a school system right now that I know causes a lot of anxiety for every school in the state is just the activity side. It's that's the portion where we get people from outside the building coming in. You know, it's like Troy said, the mask compliance with our staff and our students is pretty darn good. And you know, we were really worried about that going in, but it's gone really well. But then you start bringing people from the outside and ensuring that everybody's wearing their mask and socially distancing and doing what they got to do. We have yet to have any confirmed spread within our school system. Not one time do we know of somebody getting it from within the school system. They've all come from the outside. So the small gatherings on the outside, family members, what have you. And so we just need to continue to make sure that we're doing what we got to do outside of school. That way we can stay in school as well. And, you know, what we've seen just in our test scores between last year and this year, our kids had a significant slide. They're calling it the COVID slide, you know, which we're trying to rebuild back, because when you lose 1/4 of your school year, that's a big deal. And so getting it back, and we're building on that now, we really can't afford to be out again, not only on their academic side, but the mental health side. We're seeing more and more studies just about the toll that took on young people's mental health, being away from school and away from the social situations during the spring of last year. So that's something we're really cognizant of. We want to make sure we keep kids in school. We just got to have the resources to do so. And at this point, those resources are people. With that, I'll turn it over to Jeff if he's got anything.
Good morning, everybody. What I'd like to definitely get across is that our community will owe our teachers a real debt of gratitude for what they do right now, because it's a tremendous amount of work that they are having to do. We have 375 students here. 65 of them are in online learning or remote learning right now that are quarantined. None of it is school spread. It's come from outside. Most of it has come from parents being positive. I think realistically, we've only had 6 students who have actually tested positive. We do have now 3 teaching staff that are positive that have happened within the last 24 hours. We were able to cover it. But like Dr. Lafaholt said, you know, it's going to get to the point where eventually you wonder, will you be able to staff all of the classrooms that you're going to need to do. For our standpoint, from the Catholic school standpoint for the 4 schools, you know, we intend to be in school. The only reason that we would ever have to move into hybrid or remote learning would be that we just can't staff the rooms. You know, we understand that it is the utmost importance that our kids are here in school. We need them here. They need to be here from the social and emotional learning as well too that comes with it, let alone just the academic piece. But we all need to be together as much as possible. So we've tried to really reiterate to our families how important it is that they are masked, that they need to take that seriously, and that the gatherings that they might have, I know that there was one a couple weeks ago, just a group got together and there were 16 people there, and within 24 hours, 12 of them were COVID positive. So I mean, those types of things are happening, and that really has a domino effect on our schools. So, and because our schools affect what happens throughout our community, so much of our community, it's of the utmost importance that we do what we can to keep the schools going. So with that, I'll turn it back over to Gene, and hopefully we could find a way to keep grinding through this.
And I thank all of you, just not only the partnership that we hear about and you've demonstrated just on this call between our medical community, Good Neighbor, East Central Health District, the hospital, as well as the ongoing conversations you have. I know Kathy Fuscher's on here from the college. That educational and medical partnership is so critical, and it's almost like a tri-legged stool here when you bring in the business side of it. And you've posed a real interesting question for us as businesses of what we need to do and how we can help. Now, one thing one of you mentioned the governor's new restrictions. Only household family members can attend extracurricular activities like club sports or school sporting events. Does that change anything of what you're already doing, or does it heighten it? Or as you're still looking to provide these activities for students, can you speak a little bit of that to that before we move on?
Yeah, it will change a little bit of what we're doing. We've been allowing up to 4 people in our activities, family members. It's probably going to limit us now to 2, and just immediate families. So the 25% indoor capacity includes those who live in the household only. So it probably excludes grandpa and grandma, aunts and uncles, et cetera. So it will have a big impact. In fact, we're already changing some things with some elementary vocal music concerts that are supposed to happen this week. So we're already in the works, and so we'll be reducing our capacities just a little bit more, and who can attend.
It'll change things for us too. We've been complying with the 50% DHN groups of 8, but that did allow aunts, uncles, grandmas, and grandpas to attend, and that will obviously no longer be possible. You know, in the fall, it's volleyball is really your only indoor event, and now you go into the winter where you got wrestling and basketball, which also have more games in a night and typically fairly large crowds. So it's gonna change, you know, our understanding. I mean, the DHM isn't even officially out, just the notes on the changes as about an hour ago, but we'll get to work and we'll comply with it moving forward. I was interested, Dr. Lofholtz earlier said that we started with DHM 3. I'd be interested to know which DHM we're currently on, because it seems like about every 2 weeks we're reinventing the wheel.
I'm not sure who's typing, so I don't know if that came across to everybody else, but if you could mute yourself while you type, that would, I know we're all multitasking. Anything else on that particular, because we're going to move into like the business partnership now as well. We have a lot of employers who obviously have employees coming to work. They too have gatherings and work that needs to be done. We do have a question in the queue about what small businesses can do to help support some of the efforts going forward. It also applies to large businesses as well. And I asked Phil Raimondo to speak to what he's seen. He's a larger employer, obviously more hundreds of employees, but they too go home, come back, have to work in that environment. There's protections that they've taken there at the manufacturing facilities, just like the schools are doing. Hopefully they're complementary to one another, but we still then need to move into our small business as well. But I would like to hear from Phil from a business standpoint on a large employer. Can you speak to what you've seen over the last 8 months, Phil?
Yeah, good morning. Can everybody hear me okay? It looks like it's all right. So I will tell you that with this whole thing started way back in March, our first positive test wasn't until May for Balin. And as of this morning, we're at 43 positive tests from that whole time period. And up until September, we had no positives in the office. So we were not lax, I would say, but we were offering people to wear masks, and we were in May and June, we were taking temperatures. In July, we stopped taking temperatures for a while because it just seemed like it wasn't very, I don't understand it exactly, but we didn't have a lot of positive tests. So we were asking people to take care of themselves. We handed out digital thermometers to every partner in progress or employee that we have so that they can self-monitor. And we managed through that from the middle of July until the middle of September. And then for whatever reason, we had about 4 people in the office that tested positive. So we tried to do a little wake-up call for everybody. We actually sent everybody in the office home on a Thursday and a Friday in September. And we did a deep clean. We had Service Master come out on Saturday and do a deep clean for our office area. And then we came back to work on the next Monday. We started taking temperatures again. The masks we distributed in the office and asked people to wear them if they were in the hall, if they went to the restroom, if they went to the cafeteria. We switched the cafeteria back to takeout only. There's been a lot of things that we've just gone back to more routine. We're taking temperatures again. So I got my little sticker. I don't think you can see it, but we're doing a little bit more thorough job. We've been working closely with occupational health services to help us manage that. And they're much more thorough this time as far as always asking the same questions and making sure that people are paying attention. Because I do think, you've heard people talk about COVID fatigue. I can believe, I might have a little of that too, but I can believe that people are just sort of worn out, and, they want to follow the procedures and they want to do things right, but sometimes you forget a mask, and it only takes a couple of times with the wrong people or the right people to start this spread. So, we've been doing a lot of those things. We've made a very disappointing decision from my perspective to not allow Santa into Balin the first week of December like we always do. So the kids' party is going to be, we're going to do something for our employees' kids, but we're not going to have Santa here, and we're not going to have a Christmas party. So those things that we count on relationships and getting people together in not just a work setting, but in a less formal setting. That bonding is not happening like it used to. We canceled our picnic. So we're working hard to comply with things, not have the social gatherings, and just do the best we can with making sure people are working in our plant. There's a tremendous amount of social distancing that happens in almost every job. For a welder, he's got his own face mask and his own air system. So we haven't done anything unique in those cases. And also where they're 6 feet apart or more, we've been asking that it's not required that people wear masks. A lot of our employees do wear masks coming to work and leaving work. So I can see that people are trying and helping. And as far as what happens if the schools have to go remote again, one of the things that we did right away back in March was we offered people a chance to work an off shift or to move to alternate their schedule. So if one parent is on first shift and the other, or they're both on first shift and one wants to go to second or third shift. We've had a few people that have taken us up on that. And that seems to help. If it's more of a long-term, well, hopefully it isn't. Hopefully the announcement about the vaccine today is going to help us. We all know it's not going to be me first, but if they're starting that process, and after the first of the year and late winter or early spring, we start seeing light at the end of the tunnel, I think people will be able to adapt and hopefully get through this without any further confinements or quarantines. I don't know. Everybody's doing really, really good as far as I can see. When people do get sick, they keep themselves isolated, and we've had everybody in Columbus recover. And our other plants in the other parts of the country have had some positives. Baker City, Oregon's the only one that hasn't had any positives, and I'll knock on wood for that. But we are just very fortunate for the most part with how we've gotten through this. So I covered a lot. I don't know if there was anything that I missed, but if anybody has any questions, I'm more than happy to answer.
Thank you very much, Mr. Raimondo, as well as our schools. And we do have a couple of questions in the queue that I would like to ask. So with employees, you might be a small business or even a large business. What's your practice? So if we see an uptick, we have employees that are positive or they're suspected COVID patients, and some of them are high school students. These kids go to school and they do still work. So what can a small business do to assist in this partnership that we want to have throughout the community? Is that something a school would like to address, or maybe Mr. Hanson or Dr. Klein?
This is Mike. I can talk about what we're doing here, and certainly it applies to other businesses as well. We do have a mask policy here at the hospital, so everyone in the hospital wears a mask, and everybody that's coming into the hospital is required to wear a mask. We have been screening since the very beginning. We went into incident command on February 27th, and then we saw our first COVID patient on April 25th. But we have screening at all our facilities, and we provide screening to a lot of the businesses here in town and in the region. Our occupational health department serves over 900 companies, and we provide screening for a lot of those, as well as the local governments and things like that. So screening, I think, is very important, and you know, it's been very successful for us. You know, we have a big construction project that we've been doing. We've been able to continue that with all the screening that we're doing with the construction workers. We have a child care center that we've kept open this whole time, and we've done that because of the screening and the extra cleaning and nurses over there. So I think if you take those precautions, you can keep your business operating. And you know, I heard from most of you say that you know, you didn't have staff that were COVID positive because they got it at work. They're getting it in those small gatherings outside in the community. So again, I would just educate your staff and your employees or students that when they go home, they have to abide by the same measures in terms of compliance, because I think that's where things are happening in those small gatherings throughout our community. So that's kind of what we're doing. And any questions?
Thank you, Mike. I would, oh, go ahead.
No, I was just going to echo what Mike said. The schools were engaged with the hospital in East Central from February 27th when he talked about going into incident command. And so I know CCC and Lakeview, SCOTUS, and Columbus Public. So from the very get-go, we had a plan. And I think if there's one thing that I can, if you listen to any of the governor's speech or press conference this morning, he pretty much said wear a mask everywhere without saying a mandate. And you know, I think it's just so important. I know there's a lot of people out there who may believe in masks or may not believe in masks. There's a lot of different opinions out there. But I'm telling you, until the last couple of weeks, it has worked. It's working in our schools with our kids. I mean, you can see that right now, but we can't control things outside of the school. And I think one of the purposes of the Zoom call is try to get some kind of control outside of our work setting within our community, and really strongly encourage our community to wear masks wherever you go. The small gatherings, we're encouraging our staff, rethink Thanksgiving. It's one time. Rethink some large family gatherings, think about, what you're doing on the weekends with other different groups, et cetera. So you're going to see a lot coming from Columbus Public and surrounding school districts within ESU 7 regarding, precautions, using the universal precautions and wearing masks as much as possible to hopefully slow the spread until, God forbid, we can get a vaccine going. Because long story short, a lot of our parents, education is our number one priority for our youth. A lot of parents would say activities are the number one priority. They want to go watch basketball and football and volleyball and the school play and vocal music concerts and band concerts. Well, I'm telling you, those things will not happen if we don't get control of this and we start doing some remote learning. So we really need our kids in school. That's part of that social, emotional, that mental health that Dr. Ploss and Mr. Anuka talked about. That is so important, because that's the activities and the education component. That's that well-rounded student, and thinking of the whole student. So strongly encourage people to, the mask thing. It's got to be used.
Yeah, Troy, this is Mike again. I try not to get involved in the political debate in terms of a mask mandate, but what I do know, according to the CDC, is that if both parties are wearing a mask, you cut the chance of transmission to less than 1%. That's huge. So, if people just be smart and they do those simple things, wear their mask, wash their hands, and socially distance, I think, we can get this under control. It's always been about compliance in all our communities. Lincoln and Omaha have mask mandates in their cities, yet their positive rates have increased just like ours. So it really boils down to compliance and people doing what they need to do.
Kind of piggybacking off this, what we've said from the very beginning is the rules are in place, and the rules for a quarantine are in place if either party isn't wearing a mask within 6 feet for 15 minutes. And so whether, as we talk to staff and parents, agree, disagree, it doesn't really matter, because the rules are in place on the quarantine. And so, if you do not wear a mask, your kid or you are going to end up in a quarantine, and we're going to lose education. And we've said that from the beginning, once you put the rules in place, we'll jump through burning hoops to keep school going. And that means putting a mask on. It means socially distancing. It means doing those things to not get kids and staff members into quarantine that will, eventually shut us down. So, those are the rules, and, we all have to play by them at this point. And hopefully we can all help each other. So, we can have a vibrant economy, and we can keep schools open, and we can all keep our staffs.
Very good. And I echo what you're all saying. I'm going to have Dr. Polk, Larry Ann Polk, speak here in a second. I did want to also mention that from a small business standpoint, and the connection to the customer is that demonstration of why it's important. If your employees don't wear masks, reconsider that. If it is something that you have visible evidence of wiping things down, having your counters clean, having the wipes very visible. Actually, if they're using a pin pad at your business, you might take that disinfection wipe and wipe it for them, so that you and your employees are showing that commitment to making sure your employee or your customers are safe. It also demonstrates that routine habit that your employees can get into, that then becomes commonplace for everyone. And I know this is a small example, and sorry, Dr. Polk, but when I go through Hy-Vee, for instance, for a while there were always spraying down the conveyor belt, right? And then they kind of stopped. And I asked them one time, do you still do that automatically? And the gal said, we'll do it if you want us to. And so again, I think they've changed that. But part of it is, we adjusted some things, and I had to mentally say to myself, I felt a little bit more, I don't know, cared about maybe when there's that extra little level of whether it's the squirt that I can put in my hands when I come in the door, whether it's, I feel a sense of their commitment to me and that caringness. And I'm sure that happens inside the plant as it does at Baylands, where you're just showing that care and that you may not be able to social distance, but you can show that you care about one another through those other actions. So thanks for letting me have a little bit of a soapbox there, Dr. Polk. Did you want to add something?
Yeah, I just wanted to share how important these precautions, this discussion of these precautions are across all industries. You know, if wearing a mask is one of the easiest ways for us to prevent, as you just heard Mike mention before. And by doing that, we're going to keep our kids in school. And by keeping our kids in school, we're keeping their parents at work. So it's so important to make sure that our kids are in school, so our parents are at work, and our hospital beds are more available so that it doesn't get filled up when there's a typical emergency that's necessary. The beds won't be full of coronavirus patients because we do have other situations that are going to be happening in our communities. And we'll also keep our communities open if our parents are working. So, you know, all of us working together, keeping our kids in school and having our communities wearing a mask is really important. We in the East Central District Health Department, the education community, are trying to do a communication campaign across every community to encourage the same sort of thing so that those 4 elements, schools, parents, work, and hospitals, can remain open. It's so important. And this kind of conversation, I think, will help us get that message across.
Thank you. And I'll be, just a side note, I'll be sending out not only this link, but also some other actions from the US Chamber and some of the other research that I've done of things that businesses can do to help emphasize and to take extra precautions, both employees as well as for their customers. And along with evidence, there's been studies done, a salon, for instance, down in Missouri, they did investigations of their transactions with their customers, and they had no transactions for those that wore masks. So there is proof out there that you can manage and help thwart the transference of the disease through those means. Other questions for our panel or any other suggestions, some best practices? There's a question here of how as a community, can we share best practices of keeping our teams motivated? Because you talk about the mental side of kids getting together. There's also that social distancing that happens in our community through our businesses too, in our employee base.
This is John Widener from over at Twin River in Genoa. We keep saying wearing masks. How about if we toss the word properly wearing masks? Cover the nose.
I bet we've all seen people that it's dropped below the nose, and how do you conventionally say, you know, it might be good if I know it's because then you get the glasses thing too, you know, it fogs up your glasses, but it's just trying to manage through and breathe it. And you may want to raise that above your nose just to protect yourself.
Yeah, it's not effective if it doesn't cover your mouth and nose, or if it's hanging around your neck, that's not going to work. So I think that's an important point.
Yep. Thank you.
Kathy Fisher at the college here. Just a reminder, I'm not sure that any of us would have raised our hands and said, yeah, I want to be the first person to put a mask on, because it's a different way of looking at how we can protect each other. But it became very clear to me as we move through this pandemic that those of us who are community leaders, people are looking to us to be that example. And so I just would encourage you, it is the simplest thing to do. And for one time, and we all forget. I mean, I walk in the door and my hands are full, and oh geez, I forgot to put my mask on, so I got to stand out in the rain this morning, put my mask on before I come inside. The college does have a mask mandate, and we have seen good compliance and are keeping our doors open, helping students continue on with their studies so that they can go in and get that job and benefit their families. But I would just impress upon this group, you were committed enough to be part of this conversation. And I would encourage you that people are looking to you as an example. And so every time that you can, you're outside, you're in businesses, get that mask on. And how many of us have had to introduce ourselves, right? Oh, I can't figure out who that person is. That's okay. Go ahead and keep that mask on and smile with your eyes, and we will all be better off for it.
Yeah, this is Christina Meyer with Juice Stop. Our students and employees, they wear their masks all the time. And positive reinforcement, positive reinforcement rewards are always huge for students and even adults. So if you guys feel the need to reach out to us, we love working with this community and are happy to give a type of reward to any of your students or employees for wearing their masks appropriately. So do not hesitate to reach out to us. We'd love to work with any and all of you guys. We want to help this community, reduce that curve in any way we can.
So we've got some businesses that want to help support. And I think going into the holiday season and those rewards, utilize your businesses for those gift cards, for things where employees can, or your employees can take advantage of the local businesses and shop there. From a branding standpoint, I know Central Community College has the masks that have their brand on them. I think CHS might as well. I don't know, I'm looking at your mask there, John. So that's a great way to market yourself and or put a positive message. Maybe a neat thing to turn that mask into something more enjoyable or more fun or even more beneficial in that regard. And if you have, Chamber's always willing to help with branding ideas and marketing things, especially as we go into the season. I'm going to turn it a little bit to a serious subject of when you feel, this is primarily directed to our doctors, when you feel you've got the common cold, how would you address this with your boss? Because whether it's a student that's a little afraid to say that they might have a sniffle or a sore throat or they aren't feeling well, or it's an employee that's a little intimidated, part of it was having a open communication with your employees. And this is what we do if somebody does get sick: go home, work from home, go get tested, whatever it might be. But many people don't want to report that out of fear of COVID ramifications. So what would be good advice there from our doctors on the value of educating your employees? Or maybe Phil, if you've run into that from an employee standpoint, the doctors and employees.
I can just share, we have encouraged everybody, if they're not feeling well, to stay home. So, and anytime that we have people that feel like they need to get tested, we have them quarantined. And we had one situation where an employee went and got tested and then came to work, and none of us were very happy. So we shared that just in general, not with any names, and just said, if you go get tested, don't come to work. Let's wait till you get the results. If you can't work from home, you can take vacation or do something. We've worked really hard not to jeopardize people's jobs under the circumstances. In fact, we've probably hired 50 people since spring. And there's even more. Our business levels are better going into this winter than we've seen in years. So we have work to do for people. It's just a matter of making sure the number one priority is health and safety. So as long as we try to reemphasize and speak first about health and safety, it's been okay. There have been people that, they try to, there's opportunities for overtime at our plant. So if you miss a day, you can always make it up. And those are the kind of things not everybody's as fortunate as we are at Bayland, but we've been trying to do things right along those lines to just emphasize over and over that health and safety are number one right now, especially even more so than they ever have been. So I'll be quiet now.
No, I think that's good. That positive reinforcement, and then just, making sure it's open communication, having a backup plan. I know around here at the chamber, there are some, who can do that job if somebody's at home, or what do we do with that situation if this person can't be there, or if this person can't be involved. So thinking through those as a team and being able to say, how are we going to handle it, or who has it, or who has the ball on that. have the symptoms changed on what we should look for or ask about? On the DHMs, it's not so much the symptoms. I'll have the doctors answer that, but there are some new, and I'll send this out as well. Just the recommendations, now a mandate about the 6-foot separation between people. This came from the governor this morning. No more than 8 people per table at bars, restaurants, and weddings. You must wear a mask in businesses where you've got close contact with your customers and persons within 15 minutes or more. Participants at restaurants and bars must remain seated unless they're going to the bathroom or ordering. We talked about the sporting events. Indoor halls and events can have no more than 25% of rated occupancy, and this was originally, or before, was 50%. Dancing is prohibited at weddings, but guests can only dance near their tables where they're in groups of no more than 8, and health clubs must remain 6 feet of separation between people working out. And those are just a highlight, kind of a summary, but I can send the other ones. But what about the symptoms? Have we seen some changes in the symptoms? Because I will echo, there's been kind of, somebody has a sore throat, somebody has diarrhea, somebody has more of a stomach flu. It just, how do we know, or what's the circumstance and the advice from the doctors on what to look for or to recommend for COVID symptoms? Dr. Klein or?
I don't believe she's on at this point. I think she went back to seeing some patients, Jean. Sorry.
Okay, that's all right. Thank you, Julie. And I'm not sure if Mike Hansen's still on or Patrick Peer.
Yeah, I'm still on. Because the flu season has already started to kick in, some of the reasons that there's been more symptoms added to the list is because now, from the clinic perspective, when somebody comes in, we're going to be testing not only for COVID, but for strep and for the flu. So we'll be testing for those 3 items. The masking is not only going to help with the reducing the surge in COVID, but should be very effective in helping to keep our flu season down to a minimum as well. So there's a double benefit now of masking besides just COVID. But the primary symptoms we're still seeing a lot of was loss of taste, smell, and a chronic headache, which is kind of new. So a lot of the folks that have tested positive have come in with complaints of upset stomach and a headache, persistent headache that is not treated readily by aspirin.
Can you also speak to the rapid tests and kind of I've heard that conflicted, and I have to admit it was for me too. I tested negative twice, and yet I still maybe thought maybe I had something. So what is the percentage of accuracy for those tests, both the nose swab as well as the rapid testing, or send out rapid?
Yeah, the nasopharyngeal test is still above 90% accuracy as long as the swab doesn't quite penetrate the skull, but goes up far enough to be able to get the sample. The rapid test is a little bit friendlier, only requires swabbing each nasal cavity remotely. It's about 70% on the accuracy and growing. But again, if somebody comes back and says that they, after the rapid test, still have symptoms, then our recommendation is to get the nasopharyngeal swab because it is so much more effective as far as giving us positive or negative results. You know, the big benefit of the rapid test is getting the results within 15 minutes.
Very good. Other questions while we have our panel here? Before we lose the opportunity, Dr. Lapholz, you talked about your live event. When will that be for parents so that our businesses can help spread the word on that?
November 12th at 7 o'clock, I think we're going to start. We're just going to do a live event. We've got Dr. Anderson and hopefully Dr. Aviles going to be online with me to answer some questions from our parents. We're going to talk about what a hybrid schedule looks like, which would be our orange schedule, and then remote learning, the expectations based upon that. And like Dr. Polk talked about, this is kind of our kickoff to about a 2-month campaign regarding, staying in, basically stay in school campaign with our community and with our parents. So we're going to kick ours off November 12th. And I know each school district's going to handle a little bit different because they do other messages on weekends. But we're going to do, we had some pretty good success with our Facebook Live before school started. So we're going to go back to it and hopefully get some questions answered.
It's in the evening, you said?
Yeah, 7 o'clock.
Okay. We do have a couple questions that came in, and this is a really good one because there's two sides. I don't feel well, I need to go tested, but the procedure for when you're exposed to someone that is either suspected or tested positive. Recommendations again from our medical community. I've just been in contact with somebody that could be or has been. What are the recommendations again from our medical experts?
What we're saying is if they're asymptomatic, to keep a mask on and resume your activities. If they're symptomatic though, they need to isolate themselves and be tested.
Okay. Good advice.
So I don't know if the other schools, I'm not a medical expert, but once they test positive, they have to isolate for 10 days. And then anybody within the household or anybody who's been coming in contact supposed to quarantine for 14 from the day they were 14 days from the day that symptoms started. So that's kind of how that's the rule we've gone by with our schools. So for example, somebody would have tested positive last Wednesday, they would come out of their isolation on this coming Friday, but if they come into contact with somebody who tested positive, they wouldn't come out of their quarantine till the following Tuesday. So that's just a rule of thumb we've been using with East Central District Health.
Yeah, that's correct.
Thank you. We have another question regarding just any kind of more visible signage for mask wearing. We have Hilton ones all over, yet guests won't necessarily wear the masks. Not sure another sign would help, but it really couldn't hurt. I know the hospital has been fantastic about all of their yard signs with the masks. They've got many billboards up that they've advertised before, but that's an encouragement to our businesses too, to have that type of messaging in your facility of, whether it's by the sink and you're talking about how to wash your hands, we've got that here, whether it's promoting the advantage of wearing a mask, talking about it regularly, but that signage, that automatic reminder certainly wouldn't hurt. And then if you're, love the Juice Stop idea, Christina, for if you want to praise and celebrate your employees, talk to Juice Stop and get some of those gift cards or something that'll motivate them for wearing it whenever or remembering it, however you want to encourage that use. Other ideas for keeping it top of mind and motivating people to adhere to the masks and to just social distancing.
We wrote a grant. We have some grant money, and I've purchased just a bunch of $10 Amazon cards. And so whenever I catch one of our staff members in public, Hy-Vee, Menards, doesn't matter, wearing a mask, the next week I catch up with them and I give them an Amazon card. It seems to work. So now they're looking for me. So that's a good thing.
Good idea.
That's a really cool idea, Troy.
Yep, that positive reinforcement. Maybe it's celebrating after X amount of weeks or something. We haven't had a case. Here's some bagels or some donuts or something we all like food. Oh, and we have passports for sale. By the way, Taste of Columbus passports and pumpkins from the Taste of Columbus. Those are always good gifts as well. Had to do that. If anyone would like to do trade outs for employees, Hampton Inn has some opportunities there as well. And in fact, that's a great idea that the chamber could look into, is maybe there's a way to collect different ideas for incentives that we could share of our members. We have a member-to-member publication that goes out every Thursday where we share, let our members talk to one another through what they're doing, what they're advertising, events coming up, things like that. So we'd love to hear opportunities that others can take advantage of one another and help support the local economy. Also, one other offer, Cargill Protein has contacted the chamber. They were the ones that gave the gallons of hand sanitizer. So I'll be putting it into our business briefs tomorrow, but certainly give us a call. Let us know if you'd like some of that hand sanitizer. I think they have up to about 300 bottles. Some need a lot, some it goes a long way, just 1 gallon, but we'd be happy to help facilitate the distribution of that hand sanitizer again for all of our businesses. Other comments to help our community stay safe and our employees healthy and our kids at school. Yes, if anybody, I had a private note. Yep, the hand sanitizer is available to our members, so thank you. And non-members too. If you know a business that isn't a chamber member, we're happy to help them too. Other thoughts? Otherwise, this is great dialogue. I really appreciate everyone. We had more than almost 120 people participate in this. Thank you, Phil, for sharing what's happening at Baylands and all the good work you're doing. Congratulations on keeping a good economy going for the manufacturing sector. After October being manufacturing month, you're still at her. That's awesome.
We have a lot of very strong manufacturing businesses in Columbus, and is very excited to be just a small part of that big community. So thank you.
Yes,
Thanks for the opportunity.
You bet. And thank you to our educational community here. Everyone from Larry Ann Polk, Kathy Fuscher, Aaron Plaz, Jeff Onutka, and Troy Lawfulholz. Thank you so much. And I'm sure you had others represented here on the call, as well as others that might have joined in. So you're doing us, like John or Jeff said, your teachers are really doing the lion's share of managing the classrooms and braving it. It kind of reminds me of when COVID first hit and we saw all those nurses with the sweaty faces and the masks that were really digging into their face. And they went to work every single day trying to curb that horrible curve, especially in New York City and other places. And our teachers are soldiers as well, going into the classroom, I'd say battle, but just making sure that our kids get the education that they need, and you as leaders in helping them do that, and are trying to maintain as much normalcy amongst the weirdness that we're living in. And then finally, our medical community, ever since, as Mr. Hansen said it in February, setting up the command center and just being there for our community, trying to be at the ready, getting word out, helping us even to today, making sure that those testing sites are available for us. So we are very blessed in this community to have this network that we have and this partnership. And on behalf of our businesses, we appreciate it. And we will do our share as the holidays approach, because we still need to make money as businesses. We still need that e-commerce coming in the door, and we'll try some innovative ways to do it for our customers, as well as our economic survival for our community. Other comments at all?
Gene, if I can make a comment in regards to support of the health department. Many of you may have read the op-ed that I had in the paper Saturday. And his staff have done a tremendous job in the last 9 months in trying to get the word out and keeping the community safe and educating. Unfortunately, in some instances, they have been openly criticized or even received threats assuming that maybe they are the ones that are responsible for some of the policies. That's not the case. Their main job is to educate and try and keep the community safe. They worked very long and hard with our partners in the healthcare community, in the educational community, and with businesses. And we appreciate the support, but would also appreciate a reminder to employees that we're not really the bad guys in all this, that we're trying to do what we need to do to make sure that the economy stays strong and our people stay safe.
Thank you, Patrick. A good reminder for us. You had also mentioned something, a question that just popped up about those rapid tests. Will they
Sure.
be available at all locations, just East Central Health District along with the hospital, or where will they be? And will an appointment need to be made to receive one?
Yeah, most of the clinics will be able to order the equipment. It's fairly expensive. There is going to be some more distributions to the long-term care facilities through the state and the federal resources. But Good Neighbor has the capability to do the testing. We do require that appointments be made. We're going to try to incorporate it into our Test Nebraska site for those patients who would benefit more from the rapid test than from the other testing. But we'll start to see more of the equipment rolling out here real soon.
Great, thank you. And one more note, because it's in the chat room here, on that hand sanitizer, the formula used, it's actually produced by UNL in the Innovation Lab. It's a FDA recipe, so it's already been approved if you're interested in that hand sanitizer. As far as needing MSDS sheets, I am not aware of that. We did not, this will probably be our third or fourth distribution, and we've never had to hand out the MSDS sheets for that. But the label is clearly marked of how it is FDA approved from UNL. Other questions? Hearing none, get out your shovels, wear your masks, and be part of this wonderful community as we head into the holidays here. And thank you, schools, for keeping our kids in school as much as you can. And I'll send this link out to everybody, but thanks so much for participating on behalf of all the chamber members. Go get yourself a juice stop.
Thank you.
Bye.
Thanks, Jean.
You bet. Thank you.
Thanks, Jean.
You bet.